Good morning to all those who make this broadcast possible. To Pepe Mejia, to our sign language interpreter, and good morning to everyone tuned in to this briefing. We start today's press conference with the unfortunate news of the death of one person with COVID-19 yesterday. The patient was an 84-year-old man from the municipality of Majagua in the province of Ciego de Ávila. The patient suffered from a series of pre-existing health conditions. He began to develop symptoms on August 26th and was admitted to hospital on the 29th. He remained in hospital for the next 29 days, 12 of which he spent in intensive care. His clinical evolution was irregular, suffering from a group of complications, which finally, on September 22nd, resulted in cardiorespiratory arrest, from which it was not possible to revive him. We offer our condolences to his family and friends. Today, 8,870 people are hospitalized in Cuba. 6,940 are under observation. There are 1,362 suspected cases and 568 confirmed active cases. Yesterday, we processed over 7,000 samples, 7,321 in our various molecular biology laboratories. 2,003 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 980 in Havana's Hygiene, Epidemiology and Microbiology Center, 960 in Villa Claras, 381 in Santiago de Cubas, 564 in the Genetic Engineering and Biotechnology Center Lab, 429 in the Hermanos Almejidas Hospital, 413 in the Naval Hospital, 409 in the Molecular Immunology Center, 371 in the Manuel Fajardo Hospital, 322 in the Fructuoso Rodriguez Hospital, 248 in the Civil Defense Laboratories, 121 in the National Center for Genetics, and 120 in the ICA laboratories. Of the 7,321 samples processed, 48 tested positive for COVID-19. That's 48 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 561,746, of which 5,270, or 0.94% of people, have tested positive for the virus. As I always mention, samples from all of the country's territories were tested. From Artemisa, 212, Havana, 3,816, Mayabeque, 112, Matanzas, 572, Cienfuegos, 288, Villa Clara, 180, Sancti Spiritus, 183, Ciego de Ávila, 1,048, Camagüey, 315, Las Tunas, 306, Holguín, 347, and so on and so forth from all of the country's territories. All of the 48 positive cases diagnosed yesterday are Cubans. 44 or 91.6% of the 48 are confirmed case contacts. This means that 90.5% of all diagnosed cases in Cuba had contact with someone who had previously tested positive for the virus. This is therefore the group at highest risk of infection. Of the 48 cases diagnosed yesterday, the source of infection linked to 4 is yet to be determined. The source of infection in 60 cases reported over the last 15 days is therefore still being investigated. Yesterday, no one to have tested positive for the virus contracted it abroad, meaning that imported cases remain at 440. Of the 48 diagnosed cases yesterday, 33 are male, for 50.6% of all cases on the island, and 15 are female, representing 49.3% of all diagnosed cases. 39 or 81.2% of the 48 cases yesterday were asymptomatic at the time of testing. Overall, 60% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing, and this figure rises to 67.3% of cases over the last 15 days. By age group, 6 positive cases diagnosed yesterday are under the age of 20, all of which, in fact, are under 18 years of age, for a total of 566 children, or pediatric cases, to have tested positive for the virus in the country. Of these, 491, or 86.7%, have recovered from the virus and been discharged from hospital. Meanwhile, 24 people to have tested positive for the virus yesterday are between 20 and 39 years of age. 8 cases are between 40 and 59, and 10 are over the age of 60. Of the 48 cases diagnosed yesterday, 29 belong to Havana, 11 to Ciego de Ávila, 6 to Matanzas, and 1 case each to Artemisa and Sancti Spiritus. Of the 48 autochthonous cases diagnosed yesterday, the case from Artemisa belongs to the municipality of Caimito. The case from Sancti Spiritus belongs to Yaguajay. The 6 cases from Matanzas all belong to the municipality of Cárdenas. The 11 cases in Ciego de Ávila belong to the municipalities of Ciego de Ávila with 4, Bolivia with 3, Venezuela with 2, and 1 each to Morón and Cerro Redondo. Finally, the 29 cases from Havana belong to the municipalities of 10 de Octubre with 7, Centro Habana 7, Regla 6, Arroyo Naranjo 3, Habana Vieja 2, and 1 case each to La Lisa, San Miguel, Playa, and Cotorro. Given yesterday's results by province, Ciego de Ávila continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 60.86. Havana follows with 20.89, then Matanzas with 10.42, Sancti Spiritus with 7.3, Artemisa 6.41, Mayabeque 3.12, Camagüey 1.05, Cienfuegos 0.49, and Holguín with 0.39. Cuba's rate, therefore, stands at 7.86 per 100,000 inhabitants over the last 15 days, slightly higher than yesterday's figure. To summarize, of the 5,270 people who have been diagnosed with the virus thus far in Cuba, 568, or 11%, are active hospitalized cases. Of these, 560, or 98.5%, are clinically stable. Yesterday, 1 person died as a result of the virus, meaning that the COVID-19 death toll on the island now stands at 118, with a mortality rate of 2.24%, lower than the global rate and the regional rate of 3.38%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 76 people were discharged from hospital. a positive result when compared with the number of confirmed cases diagnosed yesterday. One person was discharged from hospital in Pinar del Rio, 12 in Artemisa, 40 in Havana, 1 in Mayabeque, 1 in Matanzas, 1 in Cienfuegos, 6 in Sancti Spiritus, 10 in Ciego de Ávila, and 4 in Holguín. This means that, to date, 4,582 people, or 86.9% of all confirmed cases in Cuba, have recovered from the virus. Today, 2 patients being treated in Camagüey continue to be in a critical state. 6 patients in hospitals in Havana and Camagüey are also reported as serious. Yesterday, 1 new patient joined the group of those reported as serious, while 2 passed from serious to closely monitored. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 285,589 people were diagnosed with the virus, for a total of 31,377,058 confirmed cases since the start of the pandemic. Yesterday, 4,329 people died of the virus, for a total of 965,681 COVID-19 fatalities and a mortality rate of 3.08%. The region of the Americas, which accounts for 50.39% of all cases worldwide, reported 106,270 new cases yesterday, for a total of 15,810,903 people to have been diagnosed with the virus. Meanwhile, 2,006 people died of COVID-19 in the region yesterday, for a death toll in the Americas of 534,546 and a mortality rate of 3.38%. The United States continues to top the list of countries worst affected by the pandemic, with over 6,857,000 confirmed cases. India has 5,562,263 cases, then Brazil with 4,558,068 confirmed cases, and Russia with 1,109,595. From the Americas, after the United States and Brazil, comes Peru, Colombia, Mexico, Argentina, Chile, Canada, Bolivia, Ecuador, the Dominican Republic, Panama, and Guatemala. These are the countries with the highest number of cases in the region. Regarding mortality rates, Mexico has the highest, with 10.52%, followed by Ecuador with 8.76%, then Canada with 6.35%, Bolivia 5.84%, and Peru with 4.07%. This is the information we have on the behavior of the pandemic in Cuba and the world.